nursing home playing just too much video games. They need to get out of that Nintendo Smash Brothers or PlayStation or whatever they're playing out there so they're not evicted from their nursing homes. It's crazy. So we're seeing this all over the place. And so we're going to talk about that today. And there's a couple of strange things in the big, beautiful bill that nobody's really talking about. We're going to talk about that today. This is also a live Q&A. Got a bunch of questions. There's some misinformation out there about Social Security is going to be looking at everybody's bank records. Social media is just crazy. So we're going to talk about that today. Don't worry, they're not going to be looking at your bank records or anything like that. This is nothing new. All right, but before we talk about that and before we get into the live Q&As, we've already got a bunch of questions about all things Social Security, retirement, survivor benefits. When should you start your retirement benefits? How much are you going to receive? Can you work and receive your retirement benefits? We'll talk about any and all of that. Whatever you want to talk about, we'll talk about. All right, so, and then if you have any idea of, I'm perplexed about this big, beautiful bill. It makes no sense. Well, obviously it makes no sense. It's written by politicians. So here's what doesn't make any sense about this whole thing. So they set up this straw man, you know, this 26-year-old gamer that lives in their parents' basement and refuses to work and is on Medicaid. Okay. All right. So they passed the big, beautiful bill. And in the big, beautiful bill, it says, okay, if you want Medicaid, you have to work. Okay, fine. You may be on either side of that argument, but okay, let's go ahead and say, okay, fine. But then they also cut $1 trillion from the budget of Medicaid. So why, if you're saying, well, the problem with Medicaid is people that are not supposed to be getting it are getting it. So we're just going to cut those people off. Okay, well then cut those people off. And if you cut those people off, that will reduce the overall budget and the budget will kind of take care of itself. Why, pray tell, did they say, okay, we're going to take Medicaid from this particular population, actually a very, very small population. Most of the people that receive Medicaid, as we know, are those elderly gamer grandmas in nursing homes, children, pregnant women, the disabled, and there are some in expansion states, which is a whole different issue. We'll talk about another irony, another thing that makes no sense whatsoever. But there's a very, very, very small amount of people who receive Medicaid that are in that category between 18, 64 years old, not pregnant, not disabled, and all the rest of the case. And they are going to lose health insurance, Medicaid. Okay. But why cut the $1 trillion? Why cut the $1 trillion? Because that was never the intention, is to just make it more efficient and kick off people supposedly they didn't want. The idea is to get rid of Medicaid across the board. That's why you say, okay, we're going to cut it off for this people. And we're just going to go ahead and, since we're at it, let's just go ahead and cut $1 trillion off of it. So everybody's, even if you're receiving Medicare, it's going to affect Medicare. It's going to affect Medicare. If you're receiving private health insurance, it's going to affect private health insurance, because we've already seen hospitals throughout the country saying, hey, we're in dire straits. We see a lot of the income that we get coming in comes from Medicaid. And if you kick people off, though, they're going to come to the hospital. They're still going to get sick. They're still going to get injured. They're going to come to the hospital and they're not going to be able to pay. And we have to take care of it. We have to bite the bullet. And if you're receiving health insurance from work, your health insurance is going to go up. There's already been several studies that said next year, the next few years, your health insurance, it doesn't matter where you get your health insurance from, you're going to pay a lot more in premiums going forward, because hospitals and different clinics and doctors need to make up that loss. They need to make up that loss. So the whole $1 trillion just doesn't make any sense. And what we're also going to see is a snowball effect. So government budgeting, working for the Social Security Administration, when I was a sergeant in the Marine Corps, government, military budgeting, even though military budgeting is kind of strange, but it works the same. If the budget next year, let's say the states kick a lot of people off of Medicaid And they're also going to kick a lot of people off of Medicaid that were actually eligible. This last time during the end of the pandemic, when they started, it's called the Medicaid unwinding, where they started doing recertifications, they made mistakes in about 69%. So 69% of the people that were actually denied Medicaid were actually eligible. Seniors, disabled, pregnant women, children, they were actually eligible for benefits, but they were denied because of bureaucratic snafus. Okay. So now it's even worse, because part of the big beautiful bill is that they are going to do those recertifications not once a year, but twice a year. So 2 times the ability to mess it up. Okay. And they're also cutting the staffing from those Medicaid offices throughout the country. So it's even worse. So here's what's going to happen. A lot of people are going to get kicked off of Medicaid. Some people, they intended to get kicked off of Medicaid. Other people, they fell through the cracks, incorrectly denied. And then next year, when the numbers come out, there's going to be a massive reduction of the people receiving Medicaid. And these same politicians are going to come up on TV and they say, what a success. Is this awesome? We are so good. They're going to be patting themselves on the back. This is great success. Last year we had, 70 million people on Medicaid, and this year we only have 50 million people on Medicaid. See what a great job we did. We sent those 20 million people back to work, and they don't need Medicaid anymore, and they're all good and beautiful, and everything is awesome. So because we kicked off 20 million people, or 20 million people supposedly found work, which obviously that's not the numbers, they're going to cut the budget again. And they're going to say, oh, okay, since those 20 million people, we're just going to go ahead and cut it again. So that $1 trillion is going to turn into 1.1 trillion, 1.2 trillion, 1.3 trillion. And then they're going to make it more difficult to get recertified and cut budgets even more. And then the following year, they're going to come back and say, hey, we just, we moved 5 million more people to the workforce. Or they didn't move into the workforce. They don't have health insurance anymore. And now they're going to the emergency room, which costs everybody even more. And your health insurance premiums are going to go up. And then the next year, and then the next year, until they finally get what they're intended is to completely get rid of Medicaid in and of itself, the Affordable Care Act, and all the rest of it. So that's the ultimate goal of this whole thing. And another thing that doesn't make sense is that these requirements are only for 40 states. There are 10 states, actually 9. Wisconsin is Wisconsin. They always do things a little bit different. They've always been a really progressive state, even though they brought Joseph McCarthy to us, the old tail gunner Joe. I hate to say he was a former Marine, the old McCarthyism. But anyway, so bad in Wisconsin. But other than that, they're usually pretty good. They're usually a test case for democracy. They pass a lot of progressive, but they do their own thing. But so basically 9 states, sorry, Wisconsin, 9 states decided not to give Medicaid to those 30, 40, 50, 60, 61, 62, 63-year-old people that are not disabled, not taking care of children or anything like that. They decided not to do this. So the government, even if you're in Texas, Alabama, Florida, Georgia, Mississippi, South Carolina, even if you work 80 hours a week, you still ain't getting Medicaid, because you didn't get Medicaid before because those states decided not to expand Medicaid. So if you're in one of those states and say, oh, okay, next year, whenever, if I start working 80 hours, or I'm already working 80 hours, so that means I'm going to get Medicaid. No, you're still not going to get Medicaid unless you're in one of those other 40 states in the District of Columbia. Or you say, okay, well, if I do 80 hours of volunteer work, then I'm going to go ahead and get Medicaid. I'll be able to get Medicaid and finally be able to get my prescriptions and go to the doctors and all that kind of stuff. Yeah, no, not so fast. Nope. The federal government, who always talks about states' rights, they went to those other 40 states and said, yeah, states' rights, not so much. We don't like what you're doing. We don't like the fact that you expanded Medicaid to those people we didn't want to expand Medicaid to. So we're going to make it difficult, if not impossible, for you to continue to provide Medicaid to those people. But they didn't go to those other 9 states and say, hey, we we don't have an issue with a 30, 40, 50-year-old getting Medicaid if they're poverty level. They didn't go down there to those states and say, okay, the other 40 states have to do it, so now you have to do it. So I think the new abracadabra, the new magic word, is fraud, waste, and abuse. So if a politician gets on TV and says abracadabra or fraud, waste, and abuse, they can do anything. If they say there's a 26-year-old kid, gamer, lazy, refuses to work, getting Medicaid, that's abracadabra. And now we can do anything we want. And what do we want to do? We want to cut $1 trillion. So the 26-year-old kid playing video games in the basement was the cover to cut the $1 trillion, which makes no sense whatsoever why they had to do both. If you're, like I said, if you're going to cut one, then yeah, it makes no sense. Okay. A lot of questions here. I've also got a couple of video questions people sent in, but I wanted to talk about something that's going around. A lot of people ask me about, supposedly the Social Security Administration is going to be looking at all your bank accounts. There's someone that did a video. Okay, I'm going to be nice. There's someone that did a video that took this emergency message and they built it all up. These are emergency messages. The emergency message is basically, hey, Social Security employees, we've got this new thing. And my office, we used to have a meeting. We have to send this out and said, okay, hey, there's a new policy that begins immediately. We have to make sure we do this. It's basically central office, Baltimore office, the headquarters of Social Security, kind of doing things at the last minute. And that's usually why they sent out an emergency message, because they didn't plan well enough. But anyway, so they sent out a message, sometimes it's a political type thing. They sent out a message that says, okay, from now on, y'all have to do this. And we say, we have a little training. Okay, here's what I have to do. So it's not some conspiracy thing. And this is not a secret email. All of these are 100% online. Anybody can see them. Okay. And here's where the conspiracy, the tinfoil hat thing comes in. This is for SSI aged. SSI is not Social Security. SSI is SSI. It's Supplemental Security Income. It's a new program that was started in 1974. It wasn't part of the original Social Security Act in 1935. It was started in 1974. It's a welfare-based program, a needs-based program. Supplemental Security Income. The max you can get on SSI is $967, okay? And you can get it based on being disabled. So if you're disabled and you're not eligible for SSDI on your own record, or your SSDI on your own record is low, then you might be able to get SSI. It's a welfare-based program, limited income, limited resources. And for over a decade, since 2011, if you want SSI, Supplemental Security Income, you have to give Social Security permission to check out your bank records. It's a welfare program. Duh. So if you say, no, I don't want to give you permission, then all right, so your case is denied. N18 as the internal code is. And so people say, okay, yes, I give you permission to check out the financial institutions. That's basically it. So it's been around for over a decade, and all they did with this new emergency message is they changed the threshold. Up until now, they only checked your financial records every now and then, just to see if, if you're on SSI and all of a sudden you get some inheritance or you win the lottery and $10,000 goes in there, Social Security really needs to know about it so they can, find out what's going on and where you got that extra money, and then possibly, stop your welfare-based benefits. Seems logical, right? So that's exactly what they do. All they did was change the threshold in this emergency message. Before, the only time they did that is if you had $400 in resources. That's it. $400 in liquid resource tolerance when applicable. That's all they did, is they said, okay, effective August 1st, if you're doing a case, Social Security employees, if you're doing a case, they're going to start with SSI aged. So you can get SSI based on being disabled, or aged, that is 65 and older. So they decided to go ahead and start this new thing. You know, they always try to do it incremental. So I don't think this was Doge doing this, because when Doge does something, they always do it a stupid way. So I think these are actually Social Security employees that, you know, experts that know how to do the system. And what they do is they said, okay, yeah, we're going to do this new thing. We're going to remove the $400 tolerance, but we're only going to do it for SSI aged, since there's not that many of those. And that way we can check the system, make sure everything works, and then we will expand it. We expect to expand the scope of this new policy beyond SSI AI allowances, age allowances. So that's it. They're just going to expand it to disabled, to the rest of the people receiving SSI, and redeterminations and limited issues. Those are, you know, I don't want to get too technical, but it's basically other people that if you're already receiving SSI aged after, you know, 1 year, 2 years, 3 years, and you come up for recertification, then they're allowed to check then. So they're going to expand it to that one as well. So the person on social media said, oh my gosh, look, they're going to expand it. We're going to expand the scope of this policy to other things as well. And person went off the deep end and started saying, oh, that means people are receiving retirement benefits and survivor benefits and regular disability benefits or any type of benefits. Social Security is going to be knee deep in all your financial records, and they're going to look at everything. And if you're making too much money, they're going to stop your benefits. And it reminds me of the Soviet Union during the Cold War in the 1980s. There was an argument that said, if we don't keep fluoride in the water, we're going to be invaded by the Russians. Because it was this slippery slope. It's like, okay, if we don't put fluoride in the water, too many people are going to get, young people are going to get cavities, and too many people get cavities. They're not going to be able to join the military. And if they don't join the military, we're not going to have a strong military, and the Soviets are going to invade us. So we need, we need fluoride in the water. So this is a fluoride in the water. Yeah, BS. So yeah, so there's that. I went a little bit too long, but social media, stop, please. So, all right, let's get into some questions here. And if you disagree, if you can explain why they targeted this group and said that's going to solve everything because that's how we did to kick off, and then they also, you know, cut $1 trillion. If you see any logic in that, then please let me know, because I don't see anything. Dr. Weir, I think you'd be an excellent leader as the new commissioner of the Social Security Agency. Just need to get rid of Doge. Yeah, the new guy is Doge. Yeah, Doge adjacent. He said he's a Doge guy. Bella, what's up, Bella? Grocery card is our medical insurance card, actually. We use it for dental, vision, hospital. Dr. Ivers counter groceries, yes, the wearables, that's a big sign, head or wrist. Okay, yeah, so a lot of people have questions about those grocery cards and whether they exist, whether a scam or whatever the case may be. They do exist. They're not a scam. The way they're advertised is very, very scammy. They take the best one in the country and advertise it to everybody. And then you call whatever Facebook ad that you saw it on, you call them up and they say, hey, if you don't live in this zip code in the country, then you don't get it. And they just kind of, it's a bait and switch type thing. So if you want to see if there's one available in your area, then you can reach out to a chapter there who sponsors this live Q&A, and they can help you out. Can you receive Medicaid if you're getting survivor benefits? Absolutely. But Medicaid it's a needs-based, welfare-based program, so you have to have limited income, limited resources. But if your survivor benefits are low enough, absolutely, absolutely. So, and that's a good question, because a lot of people, that's where they're missing benefits, and that's one of the reasons I do this channel, is because you just don't know what you don't know. And Social Security policy is over 20,000 pages, and it's crazy difficult. And then they're coming out with emergency messages to change little policies and tweaks and stuff all the time. So you have to keep up on it. So you can collect survivor benefits, but it depends on your particular state whether you're eligible for Medicaid. So if you're having a hard time, you know, on a daily basis, a monthly basis, call your state social services, welfare, Medicaid, whatever, you know, agency in your state handles Medicaid, and see if you're eligible. Apply. With all of these programs, it doesn't hurt to apply. All they can say is no. And then if you disagree, then you file an appeal, you fight it. But yeah, definitely, definitely. And remember, if you're in survivor benefits, if you've been on survivor benefits for a while, I got a message yesterday that someone said they watching our channel here, they realized they're on survivor benefits and they didn't switch to retirement benefits on their own record when they should have. Now they're 72 and they essentially missed 2 years worth of increased benefits because they forgot to switch to the higher benefits on their own record. So if you're on survivor benefits, your benefits are on your own record. If you never touch them, they will continue to increase. So make sure you check to see if there's any more money on your own record. So if your benefit is low enough on survivor benefits, retirement benefits, disability benefits, whatever, and you're having a hard time, absolutely call Medicaid, apply, see if they can help you out. If they can, then there is called the Medicare Savings Program, where they will pay for your Part B premium if you are eligible. So you can have SSI, survivor benefits, Medicare, Medicaid, a Medicare Advantage dual eligible plan that has one of those grocery cards. You can have the extra help with prescription drugs. One person can have every single one of those all together in one package. But a lot of people miss one or two parts of that. And yeah. Let me see. Wendy, I am 100% disabled and 57. You say something about being able to draw early on my ex-husband's Social Security. Is that correct? And how do I get this accomplished? So if you're 57, your ex-husband, so you can collect, if you're 57, basically the only thing you can collect now is disability on your own record. If you're a disabled vet, that doesn't preclude you from signing up for Social Security disability insurance. So you can file for disability insurance on your own record. Or you can also file as a disabled widow. If you're a widower, surviving spouse, there's called disabled widows benefits from 50 to 59. Other than that, if you're not disabled, if you're not eligible for all of that, then the next would be 60 years old. Survivor benefits start at 60 years old. And I got another comment the other day that everybody thinks everything is 62 with Social Security. It starts at 62 for early. And they missed 2 years of survivor benefits because they didn't know survivor benefits start at 60 or 50 if you're disabled. So yeah, if you want to get that accomplished, call Social Security and file for disabled benefits for your own. If you're a disabled vet, file for disability benefits on your own if you're not eligible. If you're a surviving spouse, then check on that one. If not, then just you'd have to wait till you're 60 to get a surviving spouse. Or if it's not a surviving spouse situation, then yes, 62 years old. But you have to file for benefits on your own record. So, Carrie, what is the focus on Trump on the top of the White House giving a press conference? People watch while their life joy happens. Food, okay. Yeah, I'm not sure. Snap called me yesterday to verify daughter is also paying rent to me and is on disability, files nothing that she can't work. They're now doing what they should have been doing all along. Yeah. SNAP benefits, they check benefits, but yeah, that's one of the problems is all of the Medicaid offices, those offices that, make those decisions and process all those claims throughout the country. A lot of those offices have really, really been cut back in terms of staffing and, training and all the rest of it. So that's going to make this whole big, beautiful bill even, I guess, more beautiful for those who want to get rid of everything because people are just going to get kicked off even though they are eligible because the staff isn't there. So, but it looks like in your particular area, they are doing their things. And before I worked for Social Security, I worked for the Department of Social Services doing Medicaid and SNAP and all that kind of stuff. So what is the benefits limit for SSDI recipients to qualify for SSI? So to qualify for SSI, the benefits limit is $967. So if you're receiving over $967 from SSDI or things like that, then yeah, you're not going to be eligible for SSI because it's going to be a 1-for-1 offset. So if you're receiving $1,000, then you're not eligible for SSI because the max you can get is, if you're getting $500 from SSDI, then what will happen if you're also eligible for SSI, So, okay, if you're getting $500 from SSDI and you don't have any other income or resources to speak of, then you might be eligible for SSI. And then what happens is they'll take that $500 and give you that $500 from SSDI and then give you another $467 from SSI. And then when you're on SSI, you're categorically eligible for Medicaid. So you'll get Medicaid essentially automatically. They were going to make it easier to get you qualified for Medicaid, but the big beautiful bill said, no, we don't want to make it easy. The law that was supposed to go into effect to make it easier for those people to get what they need, they decided to postpone it for 10 years. They don't want to make it easy. I mean, why else would you do that? There's a law that the government passed to make it easy to jump over these bureaucratic hurdles. And the government, the politicians thought it was a beautiful thing to say, no, we want to make these hurdles as high as we possibly can to make it a nightmare for people to get those benefits. So they will just give up. And then next year, we'll come in and say, look at all the people that don't need Medicaid anymore. So I guess we can cut the budget even more. But we got their number, don't we? Bella, healthy food important. I had to make, oh, okay, so healthy food. Yes, yes. Ice cream is part of that healthy food. The emergency notice says at the bottom, it may go to all other sections of Social Security. They don't clarify it just for SSI. That's people are concerned. Why confusing for me? Yeah, but yeah, that's not going to happen. Other parts of SSI, supplemental security income, that would have to have, if they wanted to increase it to other parts of Social Security, retirement and stuff like that, that would have to be done by Congress. That is not done by the people that wrote this emergency message. The people that wrote this emergency message, I know it wasn't DOJ, it was regular Social Security employees, Social Security experts back in Baltimore, the headquarters. And they have zero authority to do that. Zero. Can't do it. No way, no way. How? Yeah, they can't do it. That would require Congress to change the Social Security Act and say, we are going to means test Social Security, retirement, survivor benefits, spouse benefits. And there was a bill in Congress that proposed to do that, where they said, I think it's part of the Project 2025, actually, which is scary in and of itself. But they said, we need to raise the retirement age, and we also, survivors and spouses that are receiving benefits, if they, if they have money, maybe we will not give it to them. But this is not going to come from Social Security. This has to come from Congress. And that has to be past the House, past the Senate, and signed by the president. So we're going to make sure that doesn't happen. And we're going to make sure they don't raise the retirement age and all that other kind of stuff, that they fix this thing, because I guess I have to do my daily announcement that your Social Security checks will be cut off in 90 more checks. So you have 89 more checks at 100%. So whatever your check is right now, in 89 more of those, you're going to get a 23% cut. Everybody's going to get a 23% cut. Why? Because our politicians and us have failed for the past 40 years. They were told that this day is coming, and they said, we'll turn the ship later. And later ain't here, and it doesn't look like it's going to be here. So, Dr. Ed, they're going to raise the national debt by $3.5 trillion. Why can't they bail us out? Yeah, because, yeah, the whole thing, states' rights, they always argue about states' rights. They didn't care about states' rights. They always care about the debt. They didn't care about the debt. Yeah. So all of this stuff, they, abracadabra. They found a new, a phrase. Now they're going to use that: fraud, waste, and abuse. Every time they want to do something that they just want to do, they want to corporatize. If we are no longer citizens, we're liabilities. So SSI and AI are welfare based, so different rules apply to them. Correct. Yep. That is a fact. SSI, yeah, SSI aged is SSI AI is, yeah, it's just basically aged. So took early retirement, now am 65, broke my wrist. Can I apply for disability? Absolutely. If you're under your full retirement age, you can 100% file for disability benefits if that prevents you from working. So broken wrists, but it has to be a disability that lasts 12 months or longer and prevents you from working. A broken wrist, possibly not. That's going to be a tough one. That's going to be a tough one. Unless you're an acrobat in Cirque du Soleil or something like that. But even then, they'll say, okay, all right, you're not going to be doing the trapeze anymore, but you can do the other type of jobs and stuff like that. So that's how they kind of determine that. The broken wrist is going to be a difficult one. When they cut my food stamps while I can't walk since 2 years, and how can I eat? Well, I have only $70 left per month for 2. The other 94 mother have nothing. Yeah, it's going to be tough going forward. And this has been the intent for decades, and they're kind of finally getting their way. If you're not contributing, then you're a liability. And yeah. How about stopping $400 million for a new plane for Trump and 10 million a month of golfing? Yeah, I think it was actually about $1 billion to retrofit that. And guess who gets it? Not us. It goes to the presidential library once he leaves. And so it's a private jet him and his kids can enjoy. DT just signed an order that if you're been together for more than 5 years, you're legally married. Yeah. States determine that. Yeah, so that's an executive order. That's, the states determine if you got married and divorced, that is a state issue. So unless Doge has already said they want to access all financial from the IRS. So if you understand why people are concerned with AI being in our medical and financial info, you would put that past. Yeah. I mean, you're scared that Social Security is part of that emergency message. They're going to get access to your financial. No, Social Security, again, unless it's passed by Congress and they make a means test, which, I don't see on the horizon. But yeah, they've already got, Doge is already in the IRS. So if you're worried about your, financial records and stuff like that, it's not Social Security that you need to worry about. Yeah. Do you have to pay and do you have to have and pay for Medicare if you qualify for Medicaid? Yes. If you're eligible for Medicare because you're disabled after 24 months or, you're 65 years old, then yes, you have to have Medicare Part A and Part B. If you're on Medicaid and you're in the higher levels of Medicaid, then Medicaid usually pays for your Part B. A lot of people get that. It's called the Medicare Savings Program. So if you get SSI and move to Georgia, will you be able to receive Medicaid? Yes, SSI is categorically eligible. So if you're on SSI, that is a national thing. You're on SSI because you're disabled. So therefore, you're one of those carve-outs. You're disabled, so you're eligible. Or you're 65, you're aged. So therefore, you're eligible. But yeah. But if you're not on SSI, and have Medicaid in one of the other 40 states because you're low income, low resources, and then you move to Georgia, then you lost. So the stereotype of lazy people on Medicaid people still believe. Yeah, this goes back to, the whole, welfare Cadillac queens of, the 1980s and Ronald Reagan. Yeah, this has been a long attempt to change people's ideas. And yeah, for people thinking that Medicaid hasn't been keeping track of your income before, this is delusional. Yeah, Medicaid, yes. Medicaid keeps track of your income. SSI keeps track of your income because they're needs-based programs. But Abby knows that she's a regular viewer of this channel, even though she's got young Frankenstein Igor on there, that people confuse SSI and SSA. SSI is the welfare-based program, Social Security. Yeah. Penelope, what's up? Wendy, the early benefits are only for widowers. You will not be eligible to apply for divorce spouse benefits until you're 62. That is correct. Not everyone in SSI or Medicaid relay. I would rather work than being disabled. I work 2 jobs and raised my kids. Her dad was worth. Okay. Yeah. A lot of people, that's why Social Security, the government, the politicians made the law to where there's a lot of ways people that are on disability can see if they can go back to work. So there are a lot of work incentives, but they're difficult to navigate. So I put together a guide there. I think it's in relatively easy to understand English, and also a calculator there so you can figure out. So yes, absolutely. There's so many people that, they would rather, work. They make a lot more money when they work. They get out of the house, they interact with people, and they might have liked what they do or whatever the case may be. So yeah, there's a lot of people on SSDI or SSI that want to work. Sometimes, life doesn't afford that because of their disability, or they may be able to work for a day or 2 or 3, and then their, whatever condition kicks in, and then that's pretty much it. So. But Social Security recognizes that and gives people a lot of opportunities to test to see if they're able to work. So, does FBI agent contact you about SSI benefits, or is it a scam? An FBI agent, no. Unless the whatever scam they think you're involved in is a larger multi-state scam, and the FBI is helping the Office of Inspector General and the local Social Security office or something like that. If it's part of a larger, kind of thing, yeah. But normally for SSI benefits, if it's kind of an individual thing, you'll be contacted by the local office or maybe the Office of the Inspector General. So. Let's be honest. It's the big human destructive bill. It has nothing to do with beautiful. It's the epitome of human suffering. Yes, I kind of like to use kind of the scarlet letter. If they call it beautiful and they're kicking grandma out of the nursing home, I'm going to keep saying they think that's a beautiful thing. So if spouse is alive and wife has SSDI benefits, can she file for survivor benefits and at what age? Survivor benefits, you can start your survivor benefits at 60 years old. So I'm now aware of many things I missed out on when I became disabled when my 50s as well. My hubby was 80 plus VA disabled. I was not aware of many things he should have been giving him that I did. Yeah. I mean, that's a good thing about these YouTube videos and the internet and stuff. People are a lot more informed than they used to be. So there's a lot more information out there. So that's a beautiful thing. But the key is to take action on that information. Right? Dr. Ed, how do you think we're going to raise the cap? They're among them. It's with Citizens United, where, money is free speech now. The people, if we raise the cap and we have everybody pay into Social Security like we do, then yeah, the people who control the politicians don't want that. So it's going to take a massive, massive movement, but we've done it before. I mean, that's I'm going to do kind of a historical video the next day or two I'm working on. But the baby boomers, come on. It's civil rights, ended the Vietnam War, put a man on the moon, all this phenomenal, build the greatest economy in the world and such innovation and man. And then you're going out with a whimper, cutting this, kicking vulnerable people off here and saying, well, I guess we can't do anything. It's just a big government and abracadabra. Yeah. So it's embarrassing as a boomer tail ender. It's embarrassing. So, but we're working on this. Our community is working on this. So, we're going to have it rolled out. I just talked to my computer guy and, hopefully the first week of September, the first part of it. Okay, I am 54, disabled 2 years ago. Why they cut my food stamps off and I'm in nursing home, even I have to buy water sometimes. I am buying even my vitamin supplements because of herniated disc and MS. Wow. Yeah, a lot of people don't understand kind of nursing homes. Medicare does not cover a nursing home. Most private health insurance doesn't cover nursing home unless you're talking about long-term care, but regular, health insurance doesn't cover nursing homes and stuff. And people are saying, well, no, I've got Medicare. I've got Medicare. I've got a Medicare supplement. I've got a Medicare Advantage plan. So if something happens, I get older, I get in an accident or whatever the case may be, I've got the nursing home thing covered. No, you don't. No. Medicare doesn't cover that. Your Medicare Advantage plan doesn't cover that. Your Medicare supplement plan doesn't cover that. The only thing that covers that is Medicaid, and we're gutting that. So, yeah, good luck. You will have Medicare in the nursing home. So here's how it goes. You're in the nursing home, and the daily charges for that nursing home, the food and the nurses and all that kind of stuff, you have to pay out of your pocket. If you don't have something else, you pay out of your pocket. You still have Medicare. So if you're in that nursing home and you have some type of medical emergency, you need an operation or something, then you go to the hospital, and yeah, Part A, hospital, covers the hospital. Part A, you have to pay the deductible and all that kind of stuff, unless you have a Medicare Advantage plan, and we might have some type of deductible there, co-insurance. And then Part B also kicks in to pays for the actual surgery, and Part D kicks in to pays for the prescriptions and all that kind of stuff. So you still got your Medicare, you got your Medicare plan, you got your Medicare supplement, you got your Medicare Advantage, whatever you have, covers all that kind of stuff. And then they kick you out, return you to the nursing home, and there you go. You still have to pay on your own bill that nursing home. Most of those are like $10,000 a month. The food, the staff, the room you're in, you have to pay for that. Medicare doesn't cover it. Medicare Advantage doesn't cover it. Medicare supplements doesn't cover it. The only thing, you pay for it yourself, unless you have a long-term care policy, which those are crazy expensive, or you get Medicaid. And yeah, Medicaid is going out because you've been playing too many video games, I guess. My husband is 100% VA disabled. Can he collect? Sorry for my kind of dark humor. Sometimes, Will Rogers and Mark Twain, humor sometimes, cuts to the quick of things and really brings things home. So my husband is 100% VA disabled. Can he collect Social Security? He's 61. Can he still work? Can he collect Social Security at 61? Not Social Security retirement. He has to wait till 62 to collect Social Security retirement. But if he is disabled, and being disabled from the VA is not the same as Social Security. In my office, we had a bunch of disabled veterans in my office that were working, so they're not eligible for Social Security. In order to be eligible for Social Security disability, your disability has to prevent you from working, and that disability has to last 12 months or longer. So if he's unable to work because of his disability, you can work a bit. It's called SGA, Substantial Gainful Activity. If his work is under $1,620 a month, then he might be good. So not all billionaires are unwilling to help others. Take Bill Gates and Warren Buffett giving away the bulk of their assets. Only certain influential billionaires feel entitled to keep it all. Yes, absolutely. Absolutely. But I mean, there's also the idea of, Bill Gates and Warren Buffett will say, where did they get all that money? Well, it's value added by their employees. Well, why didn't they get those employees themselves get all those billions of dollars, and those employees can give out to charity? Why did those guys decide to take all of the extra value added and put it in their own pocket and then pat themselves on the back when they started their foundations? I'm not, great that they did, but that money should be given to the people that actually, anyway. But yeah, there's that. Can I apply for my early Social Security because being diagnosed with Huntington's disease? Yeah, anybody can apply to early retirement at 62 years old. Absolutely. But if you're disabled, okay, Wendy, you're the same person. If you're disabled, you can file for disability at any age. Karen, I took my Social Security at 62, currently have VA medical care, also now have Medicare. Am I required to purchase Part B? Okay, so do you have TRICARE for life or do you have regular VA? If you have TRICARE, you have to take Part B. If you have VA, then you don't have to. But you're trying to get out of paying the $185. I understand. So, but you're happy with the VA, but what happens when you're not happy? If you move, they end up cutting 86,000 jobs from the VA, and now you can't get help. Where are you going to fall back to? So it's good to have Part B as a fallback. And if you don't keep your Part B, if you have to keep your Part B because you don't have any other credible coverage, and you decide not to, then when you sign up later, you're going to be penalized for the rest of your life. 10% for every 12 months you didn't have it. And then you'll have to wait January, February, March of that year to sign up for it. You can't sign up for it anytime unless you have a special enrollment period. So what I would recommend on you is I always recommend checking out the Medicare Advantage Part B give back. They're directed to vets predominantly. They're called Patriot plans or honor plans. So they pay for part of your Part B so you can have your cake and eat it too. And Jay Davis just said, Dr. Ed, chapter was great help to me today. They helped me cut through all of the gobbledygook to find the best combination plans for my specific needs. Thank you for recommending them. So yes, so awesome. Thank you for letting me know. So reach out to chapter there, and yeah, they can definitely help. And we've just added the Affordable Care Act because all of those millions of people that are going to be kicked off of Medicaid, if you don't want to use the emergency room as your primary care physician, which people are going to, and it's going to cost everybody even more, then that's a beautiful thing, I guess. Then the only alternative is the Affordable Care Act marketplace insurance. So I found a place to help with that. I'll put that in the remarks, the description of these videos, and that way you can reach out to them. And I'm keeping an eye on them and make sure they do awesome customer service and follow through and everything just like chapter does. And if they don't, then I will look for another place to help you all out. So, or my son will. That is true, Bella. I worked 35 years, but needed to go on SSDI. I am now FRA, but still cannot work. I wish I could. My job is going to the doctor's offices. Yeah, that's unfortunate. See, people just, most people want to work. But remember, you're no longer on disability benefits because you're for retirement age. You're on regular retirement benefit. So, stressing about, well, if I do this little odd job every now and then, is that going to kick me off SSDI and kick me off Medicare? No, nothing will like that. Because you're at your full retirement age, you're on regular retirement, you can earn $1 billion a month and Social Security doesn't care. It's not going to affect your Social Security or anything. So. Let's see, I had a question. Had a great experience at Social Security office in Taunton, Massachusetts. So helpful. Awesome. Good deal. Shout out to the Taunton, Massachusetts Social Security office. Guys, you're doing great. Bernie Sanders knows how. Yeah, he's the one that's coming up. He came up with the smash the cap and increasing benefits for those people, that really need it. But yeah, unfortunately, it's not getting a whole lot of traction in Congress because Lisa just finished my sentence because of Citizens United. Yeah, money is speech, but we are going to make speech again. Raising the cap is an easy and fair fix. I think it's doable. It is super easy to actually enact, but to get it passed through, yeah, that's the difficult part. Let's see, what other kind of questions we have here? Big Balls, Legend of Big Balls grows, Young Doge XA1 for, yeah. So, wow, I didn't hear that. Yeah, he's in Social Security right now, by the way. I heard that Trump is going to cut high earners Social Security. I qualify for ex-spouse support. Is that true? There was a bill that went nowhere that was talking about means testing spouse benefits. But Whether it goes anywhere, that's a whole different thing. So, nope, you have to be very poor to have nursing home care taken care of. Yes. If you don't have a whole bunch of money yourself or long-term care insurance that will cover it, then yeah, the only alternative is Medicaid. So, but that is slowly going away. So we're not sure. I mean, yeah, not sure what's going to happen. I think it's going to go back to Logan's Run. Yeah. So, can I apply for early Social Security at 62? And if my Social Security is less, can I apply for my ex-husband who is not retired and still living because Social Security is less and I have a herniated disc? Can't send. Okay. Yes, you can apply for early retirement at 62, and your ex-husband, if you were married to that person for 10 years or longer, even if he hasn't retired yet, that doesn't matter. You can still collect benefits on his record. It's called independently entitled divorced spouse. As long as his benefit amount, his full benefit amount is twice your full benefit amount, then yes, you can collect benefits on his record. So what happens is you'll collect benefits on your record, and the difference, you'll collect benefits on, did I say your record? Yeah, your record. And then the difference between yours and his, you'll get that difference. So one offsets the other. So that is not something that Trump could just do on his own. It would have to go through Congress. Yes, I think you're responding to he wants to means test spouse benefits. Yeah, he would have to go through Congress on something like that. So it would have to pass the House, pass the Senate, and I mean, they could do it. The current Congress definitely wants to do stuff like that. That's part of Project 2025, but it would have to go through those, and if it's not part of the big beautiful bill, they would have to figure out some other way to sneak it through as part of defense contracts or defense budget or something like that, or use those abracadabra words that there are a bunch of spouses out there that are fraud, waste, and abuse, and they can find some spouse that has a whole bunch of money and is collecting Social Security benefits, and they'll say that's fraud, waste, and abuse, abracadabra, and then yeah, I guess they could do it that way. But we're gonna make sure that doesn't happen, unless you want it to happen. So one thing is that right now they do reduce benefits for high wage earners. I mean, that's been that way. It's been this way since 1935. And that's the whole Social Security Fairness Act, which is not fair because they're giving, anyway, I won't go there. If you earned less throughout your life, you're getting a higher rate of replacement on your Social Security check. So basically, if your average earnings throughout your life, your high 35 years, is about $1,000 a month, you're receiving 90% replacement rate. So you're receiving about $900 a month. If your average earnings was $1,000, you're receiving 90%, $900. If your average earnings was $10,000 throughout your life, you're probably receiving about 35% replacement rate. And that has been the same since 1935, not those calculations, but since 1935, since day one of Social Security, they said, hey, this is for the vulnerable. That we're in the Great Depression. We need to help out people that really need this. And if you're making a lot of money, then not so much. You still paid into it, so you're still eligible, entitled to get what you paid into, but we want to make sure we focus on the people that really, really need it. And that's been here since 1935. So low income, you get more. Higher income, less percentage. You get the absolute money, the amount you get is more, but the percentage is a third. And that's been around forever. So if they want to do some type of survivor benefits or something like that, if you're high income, then maybe they'll just add another one of those. They're called bin points, 90, 32, and 15%. And they already do this for Medicare Part B. If you're receiving Medicare Part B, you're paying $185, unless you made a lot of money a couple of years ago, and then they charge you a lot more, $100, $200, $300, $400 more. So there are already means tested type of things in the program. So that would just be another addition, I guess. So yeah. This information is valuable during dark times, and knowledge is power. Yes, knowledge has the potential to be power, but knowledge in and of itself is just jeopardy. It's just yeah, it's just knowledge unless you actually put it into effect. We definitely need a national health care plan, especially for those who are seniors. I agree. Yeah, and we do Medicare, but then they privatize that with Medicare Advantage, right? What makes you think everyone is getting kicked off of Medicaid? Not everybody. Yeah, the budgets are being kicked back. And again, you just need to look at the statistics for the Medicaid unwinding, where 69% of the people that were actually eligible were kicked off of Medicaid. Not permanently. Some were permanently because they just gave up. Or they got sick and didn't take their medications, or didn't go to their doctors, didn't get their surgery because they didn't have it, or worried themselves and they're no longer with us. But yeah, so a lot of people are going to be kicked off. All you have to do is, there's stories coming out on a daily basis of people getting kicked off of Medicaid and kicked out of nursing homes and all the rest of it. Plan B, after an hour and having an agent literally yelled at me, brought me to tears, and when asked politely to schedule an appointment at our local Reno Social Security, he told me no appointments are being accepted. Yeah, that's completely unsatisfactory. Not sure what you're signing up for Part B as part of the special enrollment period. Yeah, call them up and tell them, you need to help me or I'm going to talk to Ron. Just say that. Just say that. Hey, I'm calling about my Part B. I want to do this, that, and the other. Last time someone was very disrespectful. And if it happens again, I'm going to call Ron. And they'll know what you're talking about. Ron Jackson. Anyway. He is their boss. I have a Medicare Advantage plan, and they were great with my recent hospital visit. They paid for everything, even though I have a give back benefit. I only pay $35 per month and love it. Awesome. Good deal. You picked the right plan for you. Perfect. And remember, that plan goes bye-bye December 31st. And you might have the same car, the same company and all that kind of stuff, but all the details of that plan are up for change beginning January 1st. So, once the new season comes up, October 15th through December 7th, you need to reach out to whoever, you reach out to Chapter or wherever, and say, hey, I want to make sure this plan is as awesome next year as it is this year. And if it ain't, I want to find an awesomer plan, I guess, right? Did I just make up a word? Because Congress gets guaranteed retirement. Yeah. So Daphne, mine is special enrollment period, and the agent I talk with will not listen and keep telling me I need to wait until next year. Okay. So yeah, if you need, okay. So they're thinking you are general enrollment period. They are not believing that you're a special enrollment period. So you need to explain why. Did you have health insurance from current work, yours or your spouse's? Your employer had 20 more employees within the last 8 months, and you just stopped that? Or even if you didn't stop it, you want to switch over to to Medicare Part B, then they should allow you to do that as part of the special enrollment period. I'm not understanding why they're denying your special enrollment period. It makes no sense. All right, I've got 2 video questions here. One, not sure I can help, but we'll listen to what she says.
Dr. Weir, I have a question about money that was taken out of my checking account, which I balance every day. And this is a new thing that's happened. I'm on survivor Social Security benefits and have been when my husband passed away in 2006. So I have never had any problems with balancing my checkbook or anything like that. So I wonder where does this money come from? The amount that came out for my monthly benefit showed the correct amount, but the $50 was gone.
Okay. Number one, wow, balances your checkbook. I haven't heard anybody. We're going to have you give a class on how to balance your checkbook. Yeah, I think people stop doing that, but awesome. Yeah, the $50, in terms of Social Security, the only thing it could be would be an overpayment, which doesn't sound like it would be an overpayment because Doge, if you have an overpayment right now and you didn't respond, they're going to hold 50%, not $50. They're going to hold 50%. So I don't think that was it. The only other thing I could think of it's a Part D. You have a standalone Part D prescription drug plan, and they're charging you $50, but they wouldn't do that in August. That would start, in January. So if you haven't been paying that since January, I don't think that's it too. So I don't think it's anything Social Security. I think you just need to reach out to your bank. I'm 99% sure it has nothing to do with Social Security or Medicare. If you don't have even if you have an overpayment, they would have taken out a lot more to begin with. So, all right, we got one more question here.
Good morning, Ed. My name's Bonita. I'm calling from Pennsylvania. My question or questions is this. I am receiving SSI survivors, and I will be 70 years old in January 2026. I was told to apply or switch to my own SS. I also has FERS, Roth, and a 401k. Do I have to start drawing those benefits in January? I am also retired from the railroad and already getting both SS and railroad retirement. Do you know or have a calculator, annuity calculator formula for the railroad retirement that I need to put in? It's very confusing.
Yeah, that's railroad retirement and Social Security, and then you've got your PERS but great on you. That means you have lots of options, a lot of income coming in, and sounds like, and that's good. You're in a very a lot of people wish they were in that very confusing situation you're in. So good on you for getting all that set up and able to get that set up. But yeah, I don't do a calculator on railroad. Social Security, anytime anybody came in and talked about railroad, we just sent them to railroad, and railroad usually, and it sounds like in your case, they would take jurisdiction. But in terms of switching from survivor benefits to your benefits, yes, you want to do it the month you turn 70 years old, and all that other stuff doesn't make any difference. The 401ks and your PERS pension and whatever the FERS pension, PERS, whatever it was. PERS is a state one, FERS is the federal. Then yeah, that's not going to affect your Social Security benefits at all. In terms of switching to your own, when you do switch to your own from survivor benefits, you contact Social Security or the railroad board. I'm not sure what we're looking at there on your particular case, but I would contact any one of them, and what they'll do is they'll run a jurisdictional check and to see which one you need to talk to. If you call railroad and they say you need to talk to Social Security, then you call Social Security. If you call Social Security and if they say, oh, no, your case is railroad, then yeah, it's either one will let you know who you need to talk to. So. All right. Thank you for that. And we are over an hour, and that is it for today. I'll be back again tomorrow, answer a whole bunch more questions. So y'all have an awesome night, and please